mynews.studio.
Last year, only 10 people in the world reported guinea worm disease. After centuries, this parasite's reign could finally end. So what's left in the way of total eradication?
Today is February 23rd, 2026. Let's look at the numbers for context. Back in 1986, there were 3.5 million cases of guinea worm disease every year, spread across 21 countries. Now, just 10 human cases were reported worldwide last year. That's a reduction of 99.99%.
That's remarkable, especially because there's no vaccine, no cure, and no medicine for guinea worm. All progress has come from prevention, mainly by teaching people to filter their drinking water. Why was that enough to bring down such a persistent parasite?
Guinea worm, also known as dracunculiasis, is a waterborne parasite. People get sick by drinking contaminated water. Then, weeks or months later, a worm up to a meter long emerges painfully from the skin. It's a seriously disabling infection. The only way to stop it was to block transmission, and that meant changing things village by village.
The disease mostly affects children and farmers. Imagine not being able to walk, work, or take care of your family for weeks. And with no medicines, the whole eradication effort depended on changing habits and getting communities involved.
So, how did the world pull this off? Much of the credit goes to Jimmy Carter. After visiting a village in 1988 and seeing the pain in teenagers and kids, he made guinea worm eradication his personal mission.
His strategy was unusual. He used diplomacy, at times pressuring leaders to act, negotiated temporary ceasefires during wars, and even persuaded companies to manufacture and donate water filters. There's an example from Pakistan.
Right. In Pakistan, the country's leaders weren't even aware guinea worm existed there until Carter visited. Less than a decade later, in 1997, Pakistan was declared guinea worm free.
And in Sudan, Carter helped negotiate a 6-month humanitarian ceasefire during the Civil War, just so health workers could reach remote communities. At the time, that was the longest truce of its kind. He didn't just stay in the capital either. He went straight to hard-to-reach villages, like in Ghana, where his visit sparked renewed efforts and eventual elimination.
Even after his cancer diagnosis, Carter stayed involved. In 2015, he said his last wish was to see the final guinea worm die. He passed away in 2024, just before seeing eradication. But his work still drives the campaign.
Let's look at how the campaign worked. The Carter Center built a coalition: health ministries, international experts, and most importantly, community health workers. These were the so-called guinea worm warriors. They faced tough conditions like isolation during the rainy season and had to challenge local beliefs about the disease. Their main tool was education, showing people how a simple filter could make all the difference.
And the cost? Surprisingly low. Instead of building expensive water systems, they trained villagers to use cloth filters, portable filter pipes, and to spread the word. It's a public health lesson. Sometimes small, low-cost interventions can outperform big-budget solutions.
Community volunteers really drove the effort. They taught neighbors to filter water, kept infected people away from water sources, and reported cases quickly. That grassroots approach is what led to the 99.99% drop since 1986.
But there are still challenges. As of mid-2025, guinea worm transmission continues in 6 countries: Angola, Cameroon, Chad, Ethiopia, Mali, and South Sudan. And since 2012, animal infections, especially in dogs, have made things more complicated.
Dogs can get infected and spread the parasite. In Chad, for example, the campaign changed tactics, tethering dogs during the high-risk season, treating water with larvicide, and encouraging people to cook aquatic animals thoroughly. Still, in the past 3 years, animal infections have dropped by around 65 to 70%.
Civil conflict is another obstacle. In places like Mali and South Sudan, insecurity can make it dangerous or impossible for health workers to reach affected villages. Sudan hasn't reported human cases since 2002, but because of ongoing unrest, it still isn't certified as guinea worm free.
And that's important for official certification. The World Health Organization requires every country to go 3 years with no human or animal cases before declaring eradication. So even with just a few cases, progress can stall if conflict or surveillance gaps get in the way.
The response has included political commitments, WHO resolutions, and training thousands of health workers to spot cases in remote areas. But reaching the finish line, full certification, depends on both security and continued effort.
Why does this campaign matter beyond guinea worm? It's a model for eliminating other neglected diseases. It shows that leadership, education, and local involvement can succeed, even when there's no medication available.
And the systems built for guinea worm, like surveillance networks and trained volunteers, have also helped control diseases such as river blindness and trachoma. Over 100 million cases have been prevented among some of the world's most vulnerable people.
The World Health Assembly passed a new resolution in May 2025, reaffirming global commitment. Chad, one of the last countries with cases, is leading the current push. Adam Weiss from the Carter Center summed it up. 0 is the only acceptable number.
With just 10 human cases left and animal infections falling, eradication is within reach. The WHO's goal is 2030, but the Carter Center hopes to finish sooner. The real question now isn't if guinea worm will be eradicated, but when.
This is public health history in the making. Guinea worm could soon be only the second human disease ever eradicated, after smallpox. It's a story of cooperation, persistence, and the influence of one determined leader.
That's the real story behind the numbers. A disease almost gone, a campaign rooted in prevention, and a legacy that inspires hope for global health. Thanks for joining us as we explored the path to guinea worm eradication.
Thank you for listening. This episode is brought to you by mynews.studio. Try it now for free.
See you next time.